The cost of healthcare is soaring, and that's why it's super important to understand and use these tips.
If you don't know us, I'm Larry.
I'm Hope.
And we're from Under the Median, where practical frugality meets real life.
This is one of the most frequently asked questions that we get. How can I lower the cost of healthcare? And Larry and I felt very unqualified to answer that question. So we reached out to an Under the Median viewer who is qualified to answer the question. She's an RN for 42 years, and for the past decade, she has specifically been educating people in her area about how to lower healthcare costs. Now, we should mention before we get started, we have some tips. We added all of her tips to this video, but we are not medical professionals. And even though our viewer is an RN, your healthcare decisions are yours alone to make. You need to do due diligence. If you have any questions, you need to make sure that you consult a healthcare professional.
Tip number 1, consider generic medication. Now, with all medication, there is a 15-year time period when the people that create that medication can hold a very expensive patent on it. But after 15 years, that runs out, and then other companies can pick it up, and that's where the generics come in. So if you have a medication that's at least 15 years old or older, that is a good start in getting your expenses down. Tip number 2, and I do this personally, for medications that you're on long term, this is for a condition that you're going to have maybe for the rest of your life, get a 3-month supply. A 3-month supply is cheaper. And we even found through some of our research that it's cheaper to have them deliver it to your door rather than you drive out in your car to go and get it from the drugstore itself.
If you have any questions about 3-month supply, check with your insurance company. That was how we found out that there's a specific online place that he can order his prescriptions, and they're delivered right to our door, and that is the least expensive way to buy it. Tip number 3, specialist visits are costly. If you have a new condition, always start with your PCP, with your primary care physician. They are well educated in a number of different areas. They can even do some procedures there at the office. And it's always good to begin working with someone who knows your entire medical history and is familiar with you already as a patient.
And chances are, if you have to go to a specialist, your general practitioner would have to refer you anyway. And if they refer you, generally your insurance will cover that cost as well.
Make sure that everyone that you're seeing is in-network if your insurance policy needs to have an in-network provider. If your primary care physician refers you, your insurance will generally cover it, and you'll also get in a lot faster.
Tip number 4, see the nurse practitioner or the physician's assistant. We've been doing this quite a bit with our own doctor's office because the doctor is just getting too busy, and it's much easier to be able to go to the nurse practitioner. They'll have a little bit more time to spend with you. They'll get into more detail, and they're very knowledgeable. So this is another way also to save money.
Tip number 5. Let's say that you have a chronic condition like hypertension or diabetes. You're already seeing a specialist. But if that condition is well under control and the numbers, the benchmarks that you need to meet, you're there, see if they will refer you back to your primary care physician and allow your physician to manage that condition for you. If something changes, they can always refer you back to the specialist. Tip number 6, and this is my tip for you, consider working with a registered dietitian. When I was pregnant with our 3rd son, I had gestational diabetes, and I worked very closely with a registered dietitian for the last 12 weeks of that pregnancy. That registered dietitian had a wealth of knowledge when it came to nutrition and helped me to know what to eat, when to eat, how to eat, and in what order to eat in order to keep my blood sugar levels rock solid during that pregnancy. She was an incredible 3rd person that was on my healthcare team. So I had a specialist because I was almost 40 and pregnant. I had my OBGYN, and then I had my registered dietitian. Fast forward 20 years. I'm working with a registered dietitian again right now. I recently lost 10 pounds and I have been stuck at that weight for about 12 weeks. So I thought back and I remembered that previously really positive experience that I had with a registered dietitian. So I looked for a registered dietitian and I found one through our sponsor for this video, Nourish. It took me less than 2 minutes on the Nourish website to find out if my insurance would cover my appointments, and it is. A lot of people don't know that registered dietitian visits are often covered by insurance. In fact, Nourish works with a multitude of insurance companies, including Medicare. And 94% of Nourish patients pay zero out of pocket. And here's the really nice part, guys. While Nourish confirms all of your insurance information and coverage, your payments for your visits with that registered dietitian stay at zero. It's the Nourish guarantee, and it says that you will never be charged more than their estimate. I filled out a short questionnaire about my goals. I was able to hand pick a dietitian who would understand my plant-based lifestyle. That was super important to me. In our first session, Aisha went over my medical history, my eating habits, and together we set specific goals. It was all centered around balancing my macronutrients and adding some movement each day, super important. One of the things that I love most is that she understands that my meals are going to be centered around frugal, low-cost, plant-based ingredients. And she's really helping me to understand how I can get all of the nutrients I need while still sticking to my budget and my diet. I take photos of my food and I'm able to log all of my meals in the Nourish app. The nutrition information automatically calculated for me, and I can message my dietitian anytime I need to with any questions. And I have already noticed a difference in my energy levels. I'm sleeping better at night. I feel much more positive about reaching my health and my weight goals. Nourish is the easiest way to connect with a registered dietitian and have it covered by your insurance. If you're interested in learning more and you live in the US, click on the link at the top of the video description.
Tip number 7, get your annual well visits at your primary care physician's office. These are usually covered 100% by your insurance, usually for once-a-year visits. This visit can help you in so many different ways, especially if there's something new coming over the horizon that you might not have foreseen. They usually do some blood lab work along with this, and that will show up anything that might be happening that you're not aware of. So I would highly recommend the once-a-year annual visits.
Tip number 8, I would never have thought about this. This tip comes from our viewer. If you are taking a combination medication, it may be less expensive to take those components separately. So check with your doctor and see if there are any alternatives. Here's something else too. Time-release medication generally is more expensive. So book a consult with your doctor and ask about alternatives to time-release medication, because sometimes it just has to be taken at a specific time of day and it has to maybe be taken with food. Pharmacists also have a wealth of information about that sort of thing.
And speaking of pharmacists, if you're taking 5 or more medications, check with your pharmacist and make sure what you're doing is working well for you. Make sure that each of these medications will be compatible with each other while you're taking them.
And once again, something you may not know, because I did not know this, check with your insurance company, because sometimes the insurance company has a pharmacist on call for that specific insurance company, and you can consult with them by Zoom or by phone, go over all of your medications and make sure that they are once again compatible with each other and it's covered by your insurance.
If you need to schedule your preventative care imaging, such as a mammogram or a colonoscopy, then it's more cost-effective to go to a freestanding clinic than a hospital for these procedures.
I just read about this somewhere on Facebook. One of my friends had said that they went to the hospital to have a test done, and there were all of these additional charges on there, even though like a lot of the equipment and imaging and things like that weren't even needed for the test that they did. It's because you're in the hospital setting. Therefore, you are paying for if you would happen to need that equipment, whether you actually use it or not.
This next tip I'm going to do because I've never thought of doing this either. Even if you've been getting your medications filled at the same place for a long time, check other sites like Costco. Costco Pharmacy has had lower costs on many medications and immunizations. And also, Costco takes your insurance. Make sure that if you're checking other places, that they will take your insurance as well.
And speaking of immunizations, our son Dan just needed to get an additional immunization because he's transferring to another college to finish his last 2 years of study, and they required this specific immunization. So I called the health department, which is very busy this time of year, and she said, take him to Walgreens. I was like, Walgreens? She said, yeah, Walgreens does immunizations, a whole broad range of immunizations. And because it's for school, your insurance should cover it 100%. They bill your insurance company and everything, and it's less expensive than if you had to go to a doctor to get it done.
Circling back around, if you're a veteran, check with the Veterans Administration and see if all of your medications aren't covered. Generally, they're covered 100%. Getting exercise and activity can be free and easy. Just go on YouTube and you'll find a plethora of sites which allow you to do some free exercises with them. Hope does this. She has one that she likes, and I'll hear her upstairs running that, and I'll hear the floor thump, thump, thump while she's maybe doing some jogging in place. But these are really good, and they help you stay in shape if the weather's bad or if it's too cold to get outside. If you take a lot of different medications daily, it might be very helpful for you to get a pill box. This is my pill box. This is a 2-week pill box, and it has 7 compartments across, and there's 4 rows of them because there's a row here for nighttime. So you have daytime, nighttime for 2 weeks. And I keep all of my heart medications in here. I just look at my watch and, oh, today is Tuesday, so I'm going to get Tuesdays out and take those. This helps me to track whether I took them or not. I can go back and look, and if they're missing, I know that I've taken them, so I won't accidentally take too much. Highly recommend a pill box.
Couple more tips when it comes to pill boxes. I have one kind of like Larry's, only it's like a really small one. It's just 7 little compartments. It's a 7-day one. We got it free at a health fair. So look, if you have like community health fairs, look for pill boxes that are free. Now, I don't take any regular medications, but I do take some supplements. So I can load that up with my daily supplements, my probiotic, and make sure that I'm taking them on a regular basis. And I also use it like if I'm ever on a medication, like a 7 or 10-day supply of, let's say, an antibiotic. Day can get away from you and you can think, did I take that medication or did I not? The pill box is the easiest way to know whether you took it or whether you did not take it. Right. Now, another note on pill boxes, they make new versions of Larry's that have like lights on them. They have like little alarms on them to remind you when you're supposed to take your pills. Honestly, they're just more costly. If you need an alarm to remember to take your pill, set an alarm on your watch. Yeah. And when it goes off, it will be that auditory, oh, yeah, I need to make sure that I take my pills. That's a lot easier to do than pay more for a fancy, schmancy pill box.
If you have any kind of a medical concern, call your medical provider. They usually have a phone number that you can call day or night and ask questions.
A lot of times the nurse will take your information, consult with the doctor, call you back, and usually that service is absolutely free. Now, when the kids were young, I happen to know that a couple of our local hospitals have a 24/7 nurse on-call line. I could call that anytime I needed to and ask general questions, and a nurse from the hospital would say, here's what you can try, or, they would know when to tell you, you need to call your doctor stat.
Same-day telehealth appointments are generally come with the same copay as a primary care physician would be. And these might cost anywhere from $10 to $50. They're easier to use, quicker sometimes, so consider some of those alternatives.
Another thing to remember is if you are having a common, everyday, ordinary antibiotic that is prescribed for something, check around because there are a lot of pharmacies that are offering a free or incredibly low-cost supply of a 10-day antibiotic.
Get a digital thermometer. These are inexpensive and they're extremely accurate and easy to read. They run from anywhere from $5 to $10. In fact, we don't have a digital thermometer.
We don't.
So we probably ought to take this tip up.
When our kids were young, they really, really would have loved a digital thermometer rather than the regular kind of thermometer that we used. Tip number 18. This comes from a whole lot of our viewers who have sent in this tip. If you have a Medicare Advantage plan, make sure that you know and take advantage of all the perks. Some of them include silver sneakers. Our best friends have silver sneakers through their Medicare, and it's incredibly inexpensive. What it does, it allows you to go to a local gym, and it costs you very little or nothing to be able to go. And a lot of times you can use the indoor walking track and all kinds of classes and things you can do as a Silver Sneakers member. Silver Sneakers also has online classes for when you can't leave your house. So check into that. Some of these Medicare Advantage programs also have a clause where once a month you'll get a certain amount of money that you can spend freely on food-related products. And it's not medical-related products, it is food-related products.
I got rewarded through where I worked because they had a healthcare plan there that I was involved in. And if I went and got some extra healthcare, like checkups, routine checkups, and so on, then there was a reward that they offered their people, and it was really worth doing.
Some of those rewards, gift cards, things like that are also available through those Medicare programs. So make sure you check into that. It's routine, preventative healthcare exams and things like that, and you can get rewarded for taking care of your health.
The next tip, eyeglasses. Hope and I have both done this one. If you are paying quite a bit, and you will pay quite a bit for your optometrist to check your eyes out, and if they have a way there to get the glasses there, generally they charge an astronomical amount for the lenses and the frames. So we'll just get the prescription and take it to, well, the last time we went to Sam's, and we got 2 pairs of glasses for less than 1 pair at our optometrist. So I would definitely recommend going somewhere else, checking to see if you can save some money on your glasses.
The other thing that Sam's offers, I just got a text message from them earlier this week. Come in, we'll clean your glasses, and we'll adjust them absolutely free. And they do that, by the way, for the lifetime of those glasses. Here's something else that we do that has been so helpful to us when it comes to medical related expenses. We have a separate account, and we automatically have money put into that account at the first of every single month. What we did was we created a nice little sinking fund account in order to pay for medical and dental related expenses that were not covered under our insurance policy. If you're unfamiliar with sinking funds and you'd like a tutorial on exactly how to set them up and use them, we did a whole video step-by-step instructions for you. It's right over there. The cost of healthcare is soaring. Can I do that? Maybe not.
You can do that.
It's kind of hokey. We won't do that.
Okay.